If you have hip arthritis, you might be looking for options to stay active and to avoid hip replacement surgery. In this video, we'll talk about other innovative treatment options from the world of regenerative medicine, including peptides, PRP, exosomes, stem cells, and more. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, typically, osteoarthritis of the hip, people talk about it being a wear and tear issue. And I've talked in other videos about how that's not exactly true. It's largely an inflammatory process where these inflammatory cytokines and these degradative enzymes just chew up bone and cartilage over a long period of time. The typical treatments that are offered are activity modification, which most active people aren't really excited about, oral anti-inflammatory medications, sometimes injections, although cortisone injections or hyaluronic acid injections, which are really common for the knee, not as easy to give for the hip, but that can be an option. And then they talk about some kind of surgery. Hip arthroscopy, where you go in and clean up the joint, again, done a lot for the knee, and it's probably not good for that. Not as really as much of an option for the hip, but then it's hip replacement. And my feeling about hip replacement, this is really I could do a whole video on this, but that is a reasonable option for a lot of people, but there's still a pretty high dissatisfaction rate, especially younger active people. And so you want to save that until nothing else is available. So you literally can't do much of anything else, hopefully way, way, way down the road. So then what do you do if you're trying to stay active? Again, cortisone, not such a great idea because multiple studies have shown that that tends to break down the joint. And that's where would some of the treatments from the regenerative medicine world potentially be an option to not just decrease hip pain and improve range of motion, maybe rebuild cartilage and bone, but also get you at least back headed in the right direction, getting you closer, maybe helping you do those activities that you really love to do. And there's a number of different things out there to try. And again, I'm not promoting any of this. Almost all of this is either considered experimental or it's used off label. So definitely talk to your doctor, see if these type of options are right for you. The FDA is very strict about a lot of these being considered experimental, but I do think it's worthwhile for you to also know some other things that you might not hear from your traditional orthopedic surgeon. So there are medications. One that is available from compounding pharmacies. You get a physician that writes you a prescription and you get it from a compounding pharmacy, although it will likely be available, approved by the FDA in the next year or two and available at traditional pharmacies. That's a medication called penisin polysulfate to stop that inflammatory reaction that basically involves chewing up the bone and cartilage. Should be, and early studies have shown it to be very good for osteoarthritis pain. Unknown how much that helps regrow the bone and cartilage, but certainly can be an important thing. A lot of people ask me about peptides, and I think peptides can be a role for many people. I'm a big fan. If you're going down the peptide route, go to a physician, specifically an MD who's certified in peptide therapy and who prescribes them from a legit approved compounding pharmacy, but that's the subject of another video potentially. I am not really sure how much peptides like BPC 157 or thymosin beta 4, TB4 or TB500 would be necessarily beneficial in hip arthritis. Might take care of some of the pain, might relieve some of the stress on the ligaments and tendons and ligaments, tendons and muscles around the hip joint, but hard to know how much improvement it gives to something inside a joint. But again, it hasn't been studied for that purpose. None of those peptides have. So that's a little harder to know. As far as other regenerative options, platelet-rich plasma is very popular. Again, injections into the hip joint are certainly possible. They're a little trickier than the knee and the shoulder, but they can be done. And there are studies with PRP on other locations of osteoarthritis that have shown a good success rate. Stem cells and exosomes, at least where you're getting them from, say, umbilical cords, amniotic fluid type stem cells, are not approved by the FDA. Again, they are considered experimental, and you'd be getting them from a donor. So the FDA wants people to be very cautious about that, but that can be a good option. The early studies looking at various forms of stem cells or exosomes show some good improvements. Again, especially with exosomes, the studies are largely animal studies or very, very early human studies. They're not the double-blind, randomized, placebo-controlled studies that you like, but those studies are also very, very expensive and hard to do. So it's really hard to know when those are coming. There's other options like taking bone marrow from your hip and then re-injecting that with the stem cells and other materials, other cellular compounds that are in that bone marrow to see if that is an option. Potentially, any of the regenerative treatments for arthritis where you inject it into the joint, other than a very mild risk of joint infection, which you do have with cortisone injections, for instance, all that still applies. There wouldn't be much downside other than maybe it doesn't work and you've spent that money and it hasn't helped. But I know a lot of patients will talk about how much better they feel and how much easier it is for them to get back to tennis or golf or pickleball or maybe even running, depending on what it is they like to do, better than they could before. And if that allows you to be active, certainly more than you are now, and potentially put off a hip replacement for years or decades, I would argue that's potentially a good thing. Again, these are largely experimental treatments. I give you this information just for your awareness. I would encourage you, again, this is not medical advice, but if you're considering these options, find an orthopedic surgeon that specializes in regenerative treatments, that knows about a lot of these treatments, is certified in a lot of these different things, can look at your x-rays or MRIs or whatever it is, and you guys talk about what decision might be best for you. Now, I'd love to hear your experience with your hip injury or your hip arthritis. Leave those in the comments below, especially if it's related to some of these regenerative treatments. Just know I can't basically answer a question where you're asking for medical advice, but I can take your question and answer it in a future video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video or when I start a new live stream like my Ask Dr. Geier live shows. Thanks for watching, and I look forward to helping you feel, look, and perform better than ever.